Thank you, everybody. Before we start the meeting proper, I'll just do the usual reminders for those who are attending remotely, because I think we do have a number of people attending remotely this evening. Just to remind you that you will need to keep your camera on at all times if you are a member joining the meeting. You will be muted again at all times unless you are invited to speak. And then when you are invited to speak, if you can unmute yourself, say whatever it is that you have to say, and then mute yourself again when you have finished. If you have a question, could you please raise the virtual hand on the screen, and then we will try and take notice of you and make sure we call you in the order that you've indicated to speak. And again, once you have made your comment or asked your question, if you can lower your hand again. If for any reason you have to leave the meeting, can you please try and let us know? But I do need to remind everybody that if you have to leave any element of the meeting, you will not be able to vote on something where you have not heard the whole of the debate. When it comes to the recommendations, I will invite you to vote by calling your name and asking you whether you are for, against or abstaining in respect of the motion. We've had some problems with that in the past, but we hope that we found a way of getting around that, which will just involve me calling you as soon as possible once we get to the point of the vote. So once we have said all of that, I will ask all officers and guests to turn off their cameras so that only elected members are on screen. And then I will ask Democratic Services to mute everyone and begin the recording, and then hand over to you, Mr. Mayor, to commence the meeting.
Thank you, Morning Officer. Prynawn da croeso. Good afternoon. Welcome to Merthyr Tydfil County Borough Full Council meeting on Wednesday, 2nd of October 2024. Please note that this meeting is being recorded and may be broadcast via the authority's internet site. Images and sound recording may also be used for training purposes within the authority. Item 1, apologies for absence, please.
Councillor Julia Jenkins.
Okay, thank you. Item 2, declarations of interest. Members are reminded of the personal responsibility to declare any personal and prejudicial interest in respect of matters contained in this agenda in accordance with the provisions of the Local Government and Finance Act 1992 related to Council Tax, Local Government Act 2000, Council's Constitution and Members' Code of Conduct. Members are reminded that they must identify the item number and subject matter that their interest relates to and signify the nature of the personal interest, and where members withdraw from the meeting as a consequence of the disclosure of prejudicial interest, they must notify the chair when they leave. Any declarations of interest, please? No.
If you call Councillor Andrew Barry, and we'll try
Right.
and fix that.
Councillor Andrew Barry.
Thank you, Mr. Mayor. Item 7, post 16 transport consultation. I own a contract taxi company, and as such have a personal and prejudicial interest. So I'll be retiring from the chamber. Thank you.
And the same for me, Morning Officer, please. This personal and prejudicial interest in item 7 as well.
Thank you.
Councillor Gareth Lewis, please.
Yeah, thank you, Mr. Mayor. Also on agenda item 7, I've taken advice from the monitoring officer, and I have a personal interest in this item because I have a relative who is a taxi driver, but is not. But I understand it is not a prejudicial interest because of the nature of the relationship. I therefore understand I can remain in the chamber and vote on this item. Thank you, Mr. Mayor. Thank you.
Councillor Claire Jones, please.
Agenda item 1, I got a personal interest. I currently work within children's residential, and I will be leaving for that. I was item 5. I do apologise. 5. Thank you.
Thank you, Councillor Jones. Okay, item 3 on the agenda is a presentation. To receive a presentation funded by Macmillan and delivered by the Coalfields Regeneration Trust, together improving the cancer journey. I'd like to welcome Anne Broadway to address the members, please.
Hello everyone. Thank you for asking us to come today. Michelle Rosen Woods is our Head of Operations for Coalfields Regeneration Trust. She's going to give you a little bit of a background into the programme, and then I will speak to you around the programme and how it is currently working, how engagement currently is, and what we would like to do within the Merthyr area to raise cancer awareness and support for people living with a cancer diagnosis around all the practical issues.
Right, good evening all. Thank you for having us here today to talk to you about this programme, which we've been very fortunate to be able to deliver. So in terms of Coalfields Regeneration Trust, we are celebrating our 25th anniversary this year, and the trust has been funded for those 25 years by Welsh Government. And we've done some research recently into the state of coalfields, looking at them across the UK. And our research really highlights that there's still significant issues impacting our communities as a result of the loss of the mining industry. So as a charity, our priorities are to create employment, improve skills and improve health and well-being in our communities, as research shows that they are still areas of significant concern. And South Wales, the coalfield region of South Wales, is the poorest region in the UK. So as a charity, it's our ambition to lever in resource and strategic programmes so that we can tackle those inequalities. Coalfields has got a really wide network of community organisations that we support in former coalfield communities. So you've probably heard about us being a grant funder, but we also provide community development support. So we're about championing local grassroots groups so that they can deliver more for their communities. As a part of our work as well, health and well-being is a priority. And we were very fortunate that Macmillan identified us as a key partner, given our connections to coalfield communities, to work with them on addressing the cancer inequalities that exist in our areas. We quickly identified Cwm Taf Morgannwg as a priority health board, given that there's huge inequalities in cancer outcomes and also the high rates of cancer diagnosis in our communities. So we've worked with them and developed this programme through consulting with partners and with people affected by cancer. This is a 5-year programme, which is quite unusual in that it gives us time to really test this model of working, and gives us flexibility to adjust and adapt the model as we need to. So Anne's been in post in just over a year and has done a huge amount of work around developing this model, working with our community partners. And this is a key priority for Macmillan. So I think we're really fortunate that we've got this resource in Cwm Taf Morgannwg, and that they are looking to roll this out to other health board areas. So I'll hand over to Anne now to give you some information on actually how the delivery is going and what the programme is all about.
So what I'm going to do for you now, I'm just going to play you a video that gives you a bit of an insight into the programme. After that, I'll let you know why I'm involved in the programme, and then we'll have a chat about referral pathways for Merthyr. So, if there's anyone who has been touched by that video, I am around to have discussions because it is hard hitting, but I think it's very real and it's very true. There's lots of you in this room today that know me both professionally and personally, so you most probably realise why this role is so important to me. I lost my sister to leukemia, my brother-in-law Martin to kidney and esophageal cancer. My brother has prostate cancer. My dad has cancer. So for me, this programme is so important to work, and it's so important to work within the Merthyr Borough. And that's because that's where I was born and bred. The people of Merthyr are really important to me. They always have been, but not just Merthyr, Cwm Taf as a whole. So why we're here today is to speak to you. We are not getting the referrals from Merthyr. We don't know why that's happening. They're coming in from Rhondda and Taff. We're having referrals from Taff and Cynan Valley. But for Merthyr, we've most probably, since the programme went live on March the 15th, we've only had 4 referrals from Merthyr. And I know that there are people living with cancer within Merthyr that could do with this programme and can do with the support. So what the programme is about, it is not looking at the diagnosis. So we have nothing to do with the actual cancer itself. We do everything around the practical cause that cancer can bring. So, for instance, we are dealing with people within the Rhondda and Taff Valley who have opted out of having treatment because for them, they have to catch 4 buses to get to Velindre Hospital. So one lady have said to me, whilst I've done the scoping around this programme, that it is easier to actually give up and die of the cancer than what it is to catch 4 buses to get to Velindre Hospital. So transport is a massive issue. Looking at Andrew Barry now, smiling at me opposite. Transport is a huge issue. And along with that then obviously comes the monetary factor because people can then not afford. So we looked for a taxi for somebody last week who had a call on the Monday to be in Velindre on the Tuesday. That didn't give the team enough time to be able to go to local cancer services who provide transport. It would have cost him £54 each way to go down to have his treatment. He wasn't having his gyro till the Wednesday. He opted out not to go for that treatment because there was just no way that he could afford it. Some of the other issues that are coming up for us as a team is people won't go for treatment because they don't want to leave their pets. Now, for some people, you just think, oh, for goodness sake, it's a dog or a cat. But being a pet owner myself, and I know for you, Lise, you most probably resonate with this, for someone who's got to leave the house at 7 o'clock in the morning, not to be able to come back on transport that is provided through health, they're all bussed on together, they don't come back till 6 o'clock in the evening. That is a real issue for somebody who's struggling with cancer, leaving their animal for that length of time. So everything around the practical issues is what myself and the team work with, and we try to identify services that are available to support people to be able to go for their cancer treatment. So we're quite a small team. There's myself as the manager, then we have Adam Downey. Adam is the development officer. We have Callum, who's my team support officer. Then there's a team currently of 3 link workers. We have Thomas, a senior, and Alex and Lindsay, and they are the guys that are on the ground. So even though we're actually based within the assist cancer pods within the hospital, we're only in Prince Charles of a morning of a Friday, we're still not getting the referrals from that pathway either. Whereas in Royal Glam, for some reason, people walking past the pod will make sure they come in, they'll talk to the link workers, and we'll pick the referrals up. The process is really easy. The first contact, we explain the programme to them, we gain consent for data storage, and then we set them up on what's called a JOY and an EHA system. Then the link worker will make contact and introduce themselves. They'll discuss available support and arrange to meet. They'll have those meaningful conversations, and then we work on signposted and referrals. So part of my role when I came in was to actually look at what services were already available and what services are not available. We've had something through the programme as well called the Breaking Barrier Fund. Now that Breaking Barrier Fund says exactly what it should on a tin, is we break down barriers for people who cannot go to attend these appointments. So currently we've had some applications in from Signposted Cymru, so we're working very closely with Darren, who is picking up our referrals. So somebody who needs counselling, he guarantees they picked up within 48 hours. So people are not waiting 6 to 8 months for a counselling referral. They're getting picked up within 2 to 3 days. And we're also lucky that we're all Macmillan professionals, that we can access Macmillan buddies, we can access Macmillan counsellors. So the programme support for people with cancer is huge. We just obviously need these referrals to come into us, and we need to put cancer on high on the agenda, especially for the Merthyr Borough, to find out where the gaps are, why it's not happening. And this is why I think Geraint, I was lucky enough to meet with Geraint going back a couple of months ago. He saw the value in the programme and how it's so needed and what we can do to support so many people. I know, Lisa, you've also supported me by messaging you on Messenger, the both of you. Michelle as well, to say, you know, can you try and get this out on your platforms, which you've done for me. But still, for some reason, that reach isn't getting where it needs to go. So referrals are really easy. There's QR codes on all of our literature. They can just pick a telephone up. There's a telephone number there that comes straight to us. They can just send an email. So it's not like normally you'd have to fill in reams and reams of paperwork to make a referral into the programme. We've streamlined it to make it as simple as possible. So yeah, so it's over to you guys now, just if you've got any questions for Michelle or I, and how we can work together to really make this work within Merthyr. So yeah, that's me.
Councillor Lisa Mitten, please.
Thank you, Mr. Mayor, and thank you so much. Thank you both, actually. You know, it is something I was aware of, and certainly when you sat here and, as you know, personally just losing somebody within 8 weeks of diagnosis, just on take a deep breath, Lisa, on Friday, you know, it is so important that this service is shouted about, and this service is available out there, readily available for people, you know, as you said, not just for the medical side, but all of that extra support that, you know, that wrap around that arm, that cut, you know, all of that stuff that's available to them. I've got to take responsibility myself as a local councillor. I've just been making notes now. I'm thinking already about perhaps doing a community event, you know, coffee and cake, whatever you want to call it, and get yourselves in. You know, I saw you recently up in Dowlais as well, but it is so vitally important that I think we as councillors, as a council, our comms team, etc., you know, do all we can to share the message that's out there about CRT together, to you know, share this support that's out there. And so, you know, first and foremost, I need to take responsibility to do more in sharing. And secondly, I just a plea to our comms team, if we can share this out on our social media platforms as well. I think that would be really important. But I think we could do more to do more stuff visually within the communities as well. But thank you.
Thank you, Councillor Mitten. Councillor Claire Jones.
Thank you. First of all, again, I'd like to thank you, because that was extremely interesting. First off, if you can send us the presentation, that would be really good, because it would give us a chance then to sort of copy the page that you're currently on, that we've got the telephone numbers, the QR code and everything. You sort of answered part of my question, because I've been, apologies for being on my phone, I've left my laptop, but you sort of answered some of my question, because I was going to ask, I've never heard of you. And, you know, I was getting frustrated with myself, because my dad had cancer in 2017, and I was thinking, why didn't I hear of you? But obviously I didn't hear of you, because, you know, you're relatively new. So with that, I'm asking, do you think that people are maybe signposting to Cancer Aid instead of coming to yourself? Is there sort of, are you sort of working together? You know, is it the fact that they are posting to Cancer Aid instead yourselves? That was one of my questions. And my second thing I was going to say was, are you utilising our hub in the town centre? That's really good to know, Anne, you know, because I think the hub, there's so many people going back and forth there. I think it's a wonderful facility. So to find out that you are utilising the hub as well, that's really positive. But I'll go back to, I didn't know whether you were working alongside Cancer Aid, or people are rather signposting them to Cancer Aid, you know. So I don't know what your thoughts are on that one. Thank you.
So we are working with Tracy in Cancer Aid. Obviously, I think people become very precious about people as well. So, and people are worried about their own services, aren't they? So, you know, funding and monetary value and things like that. So, yes, we are working with Tracy. I'm currently working very closely with Tracy around the Breaking Barrier Fund, because we're about to launch, hopefully, fingers crossed, if it all goes to plan. There's something in the offing for Cancer Aid that CRT Together will be supporting them to be able to launch. So yes, we work very closely together, but we don't get the referrals from Cancer Aid in Merthyr. We refer to Tracy, but we don't get referrals back. But that's something we will work on, and we are continuing to work with.
I think, sorry, I think that, you know, to me, that's a barrier that you need to cross, because when you said about our animals, there are individuals out there who don't want to go in just in case they get kept in hospital. And if they get kept in hospital, there's nowhere for their pet to go. So I think that in itself, well done on you. I commend you all. That is a wonderful thing that you've got up there. So I'll leave you go and say thank you again, and thank you, Mr. Mayor.
Thanks, Claire.
Thank you, Councillor Claire Jones. Councillor Andrew Barry, please.
Thanks, Mayor. Bill's fantastic. Really, really impressive. A lot's been said that I was going to say, particularly about the hub. We found it it's been a great success for us because the footfall past there is amazing. So make the very most of that, and I think you'll find your referrals will go up. The only other thing I want to add really is, if you've got promotional material you can give us all so that we can disseminate that. And that's it from me. But brilliant, well done, Bills.
Councillor Barry. Councillor Brent Carter, please.
Yeah, thanks, Mr. Mayor. I think Lisa's spot on. We do need to take, as individuals, we do need to take more ownership with regards to spreading the word and sharing this. I don't think we do it enough in our communities. So I totally agree with Lisa, and I think we all need to look at that and take that forward. And yes, I do know you, and I do know your family history very well. Michelle, thank you. Where do I start, really? I suppose the video. I think it's not just the words, but also the music as well. And I think that hits home to everybody as well. It's home the devastation, really, that cancer has on our communities. I'm sure I'm not alone here in the chamber to say that cancer has affected our loved ones and people we know well as well. The partnerships you have between the two outstanding organisations to enable and provide support is vital and much needed in our communities. We all need support. Thank you both for the presentation this evening. I wish you all the best with your journey, and hope you have my support to ensure we all strive to increase the amount of referrals. Diolch.
Thank you, Councillor Carter. Councillor Geraint Thomas, please.
Thank you, Mr. Mayor, and thank you, ladies, for joining us this evening. I think it was 6 months ago when I saw that I was at the launch down in Pontypridd, and we talked about coming to the council, but for various reasons, including election after election and PERDA, we haven't been able to do it. But it's great that you're here this evening. But it just shows the time delay that's involved in actually carrying out events. And even for me, the biggest disgrace that we have in this country is the time it takes to diagnose someone with cancer. And it's shocking, right? It is absolutely shocking from personal experience, I can tell you that, right? From the time something happens, from the time you're actually diagnosed, from all the testing and the long it takes, unless you go privately, you know, you've got no chance. And that's true, right? That is true. And I think that is what we got to get across to members of our communities, to get early diagnosis as early as possible. If you think there's something wrong, slightly wrong in your life, go and see a doctor straight away. Go and see them, because minutes, hours, days, it does save lives. And I think that's the message we got to get across to people. And the second thing is, where we're fortunate in Merthyr, we do have Cancer Aid. And, you know, I volunteer for Cancer Aid, driving people back and forth Lindra. It's a free service. Not everybody's got that ability. In different valleys, they haven't got it. We do have it, and it's something that we should treasure. You know, it's a great service. You know, my family used it, and it is fantastic. So, as you know, I'll support you to the hilt. Yeah. So you've got our support. Thank you.
Thank you, Councillor Thomas. Councillor Louise Minard-Vaux, please.
Thank you, Ms Mayor. I just wanted to ask about referrals. So I know you said you're based in Prince Charles Hospital on a Friday. So are you just reliant then on people kind of walking past and dropping in, or can health directly refer into you at point of diagnosis, I was thinking? Are they offering it? You know?
What's happened is we had to go through a very rigorous we never thought we'd get sign off from health, because obviously a charity going into health to run a programme, the governance and everything that I had to break down, barriers and walls to get in there. But luckily enough, we done it. So we now have complete sign off from Cwm Maganac Health Board. So cancer nurse specialists are now referring into the programme. The MAC, I'm going through the process at the moment of governance with Velindre Hospital. So hopefully that'll be signed off this week. So people from Velindre will now be able to also refer into the programme as well. So yes is the answer to that. We are reliant on people popping in Prince Charles Hospital, because the MAC unit up there most probably is the MAC nurses from down in Velindre that come up. So once I get a governance signed off with them, I most probably would imagine that there'll be an increase in referral through that.
Yeah, great. Thank you. Thank you, Ms Mayor.
Thank you, Councillor Minute-Vaux. Kerry Dinham, please.
I just want to reiterate, obviously, the importance of sharing the messages, as elected members have said this evening. Like many of you here, I know Anne really well and met with the previous leader to discuss, obviously, sharing these messages. We already have the promotional information from Anne, and we will continue to share that on all our comms channels. And members will recall that we did put a feature in it on the last Contact magazine as well. So we'll continue to work with Anne to make sure we can do everything we can.
Thank you, Kerry. Anybody else like to speak? Michelle, yeah.
Yeah, I just want to pick up on a few points. So yeah, thanks to the previous leader and to the comms team who we met with for supporting us with that. Part of the programme is we have an advisory group, so Public Health sit on that, and that gives us an opportunity to highlight to them the requirement for the early diagnosis. And we also have done some co-production work around people with additional learning needs and how they can engage with cancer services and with health around things like screening and some of the barriers that they face. So we've got that advisory group with the Health Board, with Public Health, with Macmillan, ourselves and lots of other third sector partners to try and address some of those more strategic challenges, because obviously this programme is about the practical and emotional concerns, but we are collating a lot of information on other things. So that's a mechanism to feed that information through on that. So I just wanted to make that point.
Thank you, Michelle. Anyone else like to speak? No? Well, thank you both for a very in-depth presentation. It's really informative. If you'd like to stay for the rest of the meeting, you're welcome. But if not, you're welcome to leave. Ta-da, Anne. See you. Ta-da. Okay, we continue on with the meeting then. Item 4, minutes of previous meetings. Item 4A to 4E. The leader, Councillor Brent Carter, please.
Thanks, Mr Mayor. I'm happy to move the minutes highlighted in sections 4A to 4E.
Thank you, Councillor Carter. Do we have a seconder, please?
Second, Mr Mayor.
Thank you, Councillor Jones. Take it to the vote, please.
I'm going to ask those who are attending remotely, first of all. I'm afraid, Councillor Isaac, because your camera isn't on, I'm not going to be able to ask you to vote. I don't know if there's anything anybody can do about your camera, but the law says you have to be visible. So that will be the reason why I'm not going to come to you. I'm going to come to everybody else. Councillor Gareth Richards, are you for, against or abstaining?
For.
Thank you. Councillor Darren Roberts, are you for, against or abstaining?
For.
Thank you. Councillor David Hughes, are you for, against or abstaining?
For.
Thank you. Councillor Kevin Gibbs, are you for, against or abstaining?
Against.
Thank you. And that then is carried, Mr Mayor.
Thank you, Honourable Officer. Item 5 on the agenda. Okay, item 5 on the agenda, Children's Residential Policy. To consider the report to the Director of Social Services. Councillor Louise Minute-Vaux, I invite you to address the Council, please.
Thank you, Mr Mayor. So the Children's Residential Services recently developed, and consequently the Department requires a set of policies to enable registration of Merthyr Tydfil's children's homes with Care Inspectorate Wales. And the regulations set out how the local authority residential services may comply with the requirements. So the document covers the induction, the support, the development, supervision and appraisal of staff who work in residential care, and it enables those new staff to understand how they will be supported by the management team and the requirements for them to be registered and qualified. So I'd like to move the recommendation set out in 2.1. The policy for children's residential placements to ensure compliance with Care Inspectorate Wales regulations be approved.
Thank you, Councillor Minute-Vaux. Do we have a seconder, please? Councillor Carter.
I'm happy to second that, Mr Mayor.
Thank you, Councillor Carter. Questions? Councillor Michelle Simmons, please.
Thank you, Mr Mayor. Bear with me because I do have a few questions on this tonight. So, firstly, is this a model policy that you've adopted and amended for Merthyr, or is this policy being specifically written to comply with the Care Inspectorate Wales guidelines?
So it's based on the Care Inspectorate, what our inspector wanted us to cover. So we had hoped that our corporate policies would cover it, but they wanted to have additional information. So we've sort of additional to what corporately expected in terms of supervision and probation, but they wanted it in one place rather than in different documents across the authority.
Okay, thank you, Jo. And the reason why I asked that question is that it does seem heavily focused on the corporate kind of induction rather than the induction specialised for this job role. You've answered my second question and explained why that would be. In the report as well, Mr Mayor, there is no detail of the specialist training. So, for example, the child sexual exploitation or the child criminal exploitation, even the basics of like food hygiene, which we know that would be required for this type of role. So, in your opinion, is that right? And why isn't that level of detail of training not explained in the policy, please?
Yeah, so that details in the statement of purpose for each of the homes. So what you've got to be very careful of is this is a policy review, perhaps we will review yearly. The statement of purpose will change depending perhaps the children that are in there. So what we need to do is we have a specific document per home, which is then reviewed by Care Inspectorate Wales, and within that there's more specific trainings that people will have to undertake. So it's in different documents. So this is more general, and then each training there'll be a training matrix per home, per individual staff within that home that's within, if that makes sense. Okay. So if there's self-harm, there might be more of a focus on self-harm in one, or exploitation. So it'll be very different, depending on the level of need.
Okay. And I guess this leads now into my follow-up question. So with the specialist training at 4.0 on page 25, there's no financial implications. However, for example, in the event that a decision is made that Merthyr will employ for example, an inexperienced team member or a staff member without the required qualifications, that would result in significant training costs. So my question is, why are there no financial implications?
So in terms of what we call AWIF, which is the All Wales Induction Framework, and the QCF, so level 3, which is the qualifications they have to go through, there are training providers that do it through funding from Welsh Government, so it doesn't cost us or the training, the regional training facility, it comes through different funding, you see.
Thank you very much, Jo. Sorry, bear with me. As we all know as well, safeguarding should be an absolute centric part of this policy, but it's only referenced once, and that's in the appendix to the policy on page 37. So my question now, it will be for the Cabinet member, so Councillor Minute-Vokes, her opinion on why safeguarding would not be a prime focus and referenced throughout the main policy document, please.
We do have a safeguarding policy as a corporate council which involved, and we've got separate safeguarding in terms of specific policies that have been through and passed with council before in terms of bullying and different specific areas. So we've covered it in different areas rather than trying to. My worry is we always have too much of one policy, so we've had to put into this policy what Care Inspectorate Wales wanted for this. But there are other policies. It's really difficult because I could put links into all the other policies and link them in, but it gets a bit too confusing. So we have got a specific corporate safeguarding policy which is seen, and we've got safeguarding in terms of residential.
Okay, so the way you've explained that is that there is sort of like an umbrella of policies that this actually sits under.
Or sits with. Yeah.
Okay, thank you, Jo. Mr Mayor, my last question, and this comes from my own experience. On page 37, again, in just the appendix of the policy, it references complaints. If a member of the public has an issue with a children's residential home, what does the line of resolution look like, and why doesn't this have a dedicated part within the policy document?
So this policy is about for the staff general and the supporting the induction and probation of the staff rather than complaints. We've got our corporate complaints policy, which we would refer people to if they wish to. We try and have the home managers, we try and resolve that in the first instance if we became aware of any complaints. But this isn't about complaints because that's a separate policy.
Okay.
And it's also discussed within our statement of purposes for the individual homes, which goes through CRW.
Thank you, Jo. Okay. Thank you, Mr Mayor.
Thank you, Councillor Simmons. Okay. Any other questions, please? No. Any comments? Councillor Michelle Simmons.
Thank you, Mr Mayor. Just a couple of points. I would like to see that the concerns that have been raised this evening to be integrated as part of the policy moving forward. And I understand Jo's explanations. However, when you look at the policy as it stands, unless we've got those explanations, it doesn't actually tie in. And the reason for that is ensuring that the correct people are employed within our children's residential settings and that they receive the specialised training, but timely. Employment of inexperienced staff in children's residential homes has a detrimental consequence for all parties involved. In the past, as many members have felt isolated and abandoned by the local authority, and a recent example of this contributed and resulted in Councillor Colbrand's resignation. Additionally, Mr Mayor, there is an expectation that we should have reassurances through policies such as this one, that when a member is seeking resolutions to residents' concerns and addressing safeguarding issues, that lessons have been learnt and ultimately integrated into policies as standard working practices. Thank you, Mr Mayor.
Thank you, Councillor Simmons. Councillor Geraint-Thomas, please.
Thank you, Mr Mayor, and we welcome this. We welcome this report, and you know, we're all going to vote for it. And as a former independent administration, we've totally supported the elimination of profit agenda by building and creating our own care homes in Merthyr Tydfil, to keep our children closer to home. I think that's important to us all. You know, from Daisy House, Plantation House, the work going on in Thomastown, even Campus House and Hillford Court. They're all things to bring our young children to live in Merthyr, to live active and proper lives. So yeah, we do welcome this, Joe, and we hope we've all learned from our mistakes in the past, and we move on just to make sure our care homes are the best places they can possibly be. So thank you.
Thank you, Councillor Thomas. Any other comments, please? No. Take it to the vote then, please.
Thank you, Mr. Mayor. So I can see Councillor David Isaacs now, so I'll start on my list. Councillor Gareth Richards, are you for, against or abstaining?
For.
Thank you. Councillor Darren Roberts, are you for, against or abstaining?
For.
Thank you. Councillor David Isaac, are you for, against or abstaining?
For.
Thank you. Councillor David Hughes, are you for, against or abstaining?
For.
Thank you. Councillor Kevin Gibbs, are you for, against or abstaining?
For.
Thank you. Councillor Tovey, I can't see a vote from you. And I can't see a vote from Councillor Bill Smith. I think it may be about how we're trying to manage the voting system, but I'll shout if I don't see a vote from anybody, and then that is carried, Mr. Mayor.
Thank you, Mona Rossa.
We just need to get Councillor Claire Jones back.
Sorry.
Councillor Claire Jones. Well, thank you. Councillor Jones.
I forgot about it. I think that's the first time it's been used in about 10 years. Only other was looking in, I thought. Okay, item 6 on the agenda, CCTV fostering policy. To consider the report of the Director of Social Services. Councillor Louise Minute-Vaux again, please.
Thank you, Mr. Mayor. So this report provides Council with a CCTV policy, which is attached to Appendix 1 and is being developed due to advances in technology and increasing use of CCTV and technology in homes. So to enable Foster Wales Merthyr Tydfil to be regulation compliant and inspection ready, it's important to review the department's CCTV policy, as this has become an increasing concern to the department, and there's needed a clear policy to guide both carers and staff. The policy will help safeguard children in foster care, and it is hoped that the CCTV policy will enable higher quality care and clear direction for foster carers. The CCTV policy explains what CCTV is, how CCTV can be used, issues to be considered, how CCTV cannot be used, and the basic principles. The policy has been developed based on the Fostering Network information and guidance on CCTV and technology. These policies have already been shared with the independent reviewing officer, team managers in children's services and others as appropriate. It's also been shared with foster carers, the foster panel, and will be shared at the foster carers consultation event in October 2024. I'd like to move that the recommendations set out in 2.1, the attached policy to be implemented in October 24, be approved. Thank you, Mr. Mayor.
Thank you, Councillor Minute-Vaux. Do we have a seconder, please? Councillor Carter.
Happy to second that, Mr. Mayor.
Thank you, Councillor Carter. On to questions, please. Any questions? Councillor Andrew Barry.
Just a question to the monitoring officer, really. Do you know we bring an annual report about covert and overt CCTV usage. I didn't see it anywhere through this report. Is there any relation there?
It would be dependent on circumstances. There may be occasions when we bring the Regulation of Investigatory Powers Act report, it's where we've had to seek permission to carry out covert surveillance, and that's normally with a view to investigating crime.
Yeah.
So you have to seek permission and then report how many times you've had to do that. This wouldn't be the same thing, but there may be occasions when it would be used for the same thing. And if there were occasions when it was used for that, then it would have to come into the RIPA report.
Right.
So it's not necessarily ever going to be, and I would hope it's not ever going to be, but if there were occasions when it was part of a criminal investigation, then it might have to occur in that.
But the RIPA report would trigger that rather than this policy.
Yeah, so the RIPA guidelines are separate to that because there are very, very strict guidance as to when you can use that for that purpose, and everybody then has to be told that you have used it for that purpose and that it's been considered appropriate to do so. That's what the RIPA report does for you.
Okay.
This is a policy which is separate from that.
Right. There would be no need for reference to that RIPA occasion within this report.
No.
Okay, lovely, thanks.
Thank you, Councillor Barry. Any other questions, please? No, we go on to comments then, please. Any comments? No. Nice and quick. We take it to the vote then.
So I'll go through my list again. Councillor Gareth Richards, are you for, against or abstaining?
For.
Thank you. Councillor Darren Roberts, are you for, against or abstaining?
For.
Thank you. Councillor David Isaac, are you for, against or abstaining?
For.
Thank you. Councillor David Hughes, are you for, against or abstaining?
For.
Thank you. Councillor Kevin Gibbs, are you for, against or abstaining?
For.
Thank you. And then, with all those who are present in the chamber, that is carried, Mr. Mayor.
Okay, so we go on to item 7, post 16 transport, which I have to leave. Councillor Leighton.
Okay, then we'll go on to agenda item 7, post 16 transport consultation. To consider the report of the Director of Education, I believe it's the leader, Councillor Brian Carter, will be presenting and moving this report.
Thanks. Mrs Deputy Mayor? Madam Deputy Mayor? Thank you, Deputy Mayor. Councillors will recall on the 28th of February this year, Council approved a consultation exercise to engage with the public and obtain their views on proposals to change the policy for post-16 transport to colleges and schools. The consultation was originally scheduled to run for 6 weeks from the Monday the 20th of May, and this was extended for a further 6 weeks until Friday the 9th of August 2024. The extension was needed to explore the potential impact on the Welsh language and additional Welsh language questions that were added to the consultations are outlined in 4.11 of the report. There's an amendment to the original report that was published last week. Under 9.2, if the recommendation of implementing option 2 is approved, financial savings will now not be realised until 27-2028 instead of 26-27. This is because the Learner Travel Information Wales Regulations 2009 requires local authorities to publish information on travel arrangements, and this information must be made available by the 1st of October in the preceding academic year to which the information relates. In addition, a minor correction is needed to the final bullet point of 3.9 of the report, which should read that 3 students attended Bridgend College, Pencoed campus, and not Bedlinog College. An additional correction is also needed on 8.2 of the report, which reads September 25, it should read September 26. I move the recommendation outlined in 2.1 of the report, the post-16 transport policy be updated in line with option 2, amended, as set in 1.4, provide free post-16 transport only to the college, Merthyr Tydfil, Ysgol Gyffredin Rhyd-y-Waun for pupils choosing the Welsh medium education post-16, and St John Baptist Church in Wales High School for pupils attending the School for Statutory Education. Thank you, Mr Mayor. Oh, Madam Deputy Mayor.
Do we have a second of the agenda item?
I'd like to second, Deputy Mayor.
Okay, thank you. We'd like to go to questions. Councillor Lisa Mitten.
Thank you, Madam Deputy Mayor. Yes, I can't remember the protocol with it, but thank you all the Paula. I'll just say Paula. Thank you, Paula. Thank you, Chair. Is easier, isn't it? I won't ask this of the leader or the cabinet member. I think it would be unfair to be in the first report that you are bringing to council, albeit Gareth should know because we have discussed this in scrutiny. But I'll ask the officer some questions. Anthony, you taking this in Sue's absence? Right, okay. In that case then, can I refer you to 7.9 firstly? And it says removing transport to these colleges will restrict some choices available to children and young people in the county borough. However, a wide range of courses are available at the college. My question is in two parts, so I'll go to the second part of that paragraph. College Merthyr, sorry, which helps to somewhat mitigate the risk of more young people becoming NEET. Anthony, how can that be? I don't think that's a true paragraph is what I'm trying to say. How can that be a true paragraph when it's evident that we are taking children outside of the borough because the courses aren't available at Merthyr College? And so how is that going to mitigate any needs? It's not. It's going to encourage an increased needs in the borough. And I have a second question after that.
Okay. Do you want to ask the second question first,
I tell you what, do you want to go for that one? Because I've just got to scribble down to my notes for the second one, if that's all right. Thank you.
So clearly you are right, Lisa, in terms of there are courses that aren't available in the college, and that's why currently there's transport provided to Ashram and Chabade and Pencoed. The scope of the courses that are not available in Merthyr College has reduced over the years. I think when this report was taken, I think last time it was taken to council was back in 2018. At the time, I think there was 42 children and young people accessing courses out to county in colleges because they weren't available in Merthyr College. That figure is now reduced down to 22 for the current academic year. And so in that time, the college has brought on stream more courses. I think within Appendix 5, it details the courses that aren't available. There's a number of those that are available, but not at the level that the young person is seeking to access, whether that's a level 1 or level 3. So there's scope there for the college to increase their offer. Discussions are ongoing with the college regarding what that offer looks like currently and what it may look like going forwards. And so the proposal to change the policy for September 26 would provide some additional time for more of those courses to be brought on stream, albeit there could always be some courses that a young person could access elsewhere. The animal courses that they can access in Pencoed, they wouldn't be available in the college, but some of the construction courses have started to become available in the college, and some of the other courses have as well. So I think over time that position has improved.
Okay. And so therefore, just on reflection to your answers, I would just reflect back and say, in that case, wouldn't it have been pertinent to either defer or pause this decision on post-16 transport, taking the MTFP and the monetary reasons out of it for a second, but wouldn't it have been more pertinent to have deferred that to ensure that we provide equality to all our young people in Merthyr Tydfil and help them with the options they have to not increase needs into the borough by waiting for the college to make those decisions on the offer?
Yeah, I don't think this is just dependent on the college increasing the offer necessarily. There are other courses available through the college the young people could be accessing currently. It's just how policy allows them to access the courses elsewhere.
But not those specialist courses, and I think that's important to note, isn't it? The college will not offer those at any point.
But there's courses on the list such as a cabin crew, which is not provided in the college. There's courses such as aerospace engineering, so I think further consideration could be given in terms of engineering courses that are available in the college. They do provide engineering.
Yeah.
It's just the specialism around aerospace.
Yeah.
So I think that there is scope for that to be developed.
Oh, absolutely, because that is a growth industry currently to support our economic growth as well, isn't it? So that would be important for them to do. But that goes back to my point about maybe waiting until they make that decision. Thank you, Ant. My second question is really around consultation. Heard so much in this chamber during my tenure as leader and previously how important it is to listen to the public. So can I just clarify that whilst the recommendation is to accept option 2, that overwhelmingly the public supported to keep the status quo and remain as it is? Can you confirm that? Thank you.
Yes, 52% of the public preferred to remain as is as their preferred choice, and 39% preferred option 2.
Okay.
And then in terms of the second choice, 49% preferred option 2, which is the recommended option. So I think 78% of the public voted option 2 as either their preferred or the second preferred option.
Yeah, but overwhelmingly it was the status quo, aside from those two ways of working it out, but it was option 2.
It was marginal, yeah.
Okay, thanks. Thank you, Madam Mayor, Deputy Mayor. Okay, go on, forget it.
Thank you, Councillor Mitten. Councillor Geraint-Thomas.
Thank you, Madam Mayor. I've got a couple of questions too. Due to climate change, Cardiff Capital Region have expressed a very, very close interest in producing food much closer to home, and it's part of policy now within the region. So why wouldn't we support sending our children to the agricultural college to learn those trades, right, for the future, because we have to grow our own food?
Yeah, I think the options we put before you are just the options that we've consulted on with the public, and option 2 was around ensuring that the transport was provided to the local college in Merthyr and to the Welsh medium provision and the faith provision out to County. If council wanted to decide to continue with provision to Pencoed College for those reasons, and that would be a decision for council to take, and it would have an impact in terms of the overall savings provided. But in terms of the numbers, there are only 2 or 3 young people that are provided with passes to Pencoed College. I think the cost is a couple of £1,000 per annum. So that would be a decision for council to take if they wanted to consider that as an amendment.
So that's quite a low cost then, Anthony, isn't it? Only a couple of £1,000 per annum per child, for the benefit for us all, really, for the future. Do you think it's a benefit worth keeping?
It's not for me to say, really.
Thank you. And second question is, as we know, Newport and Cardiff are going to become investment zones, part of the Cardiff Capital Region, with high-paid jobs for the future. How can we guarantee that the college will run the course to give our young people the tools to take those jobs?
Yeah, I don't think guarantees can be given in terms of meeting all of the courses that are currently available elsewhere. But just over time, more courses have been put on, and there's less children and young people that are accessing transport out to county, and those conversations will continue with the college with the aim of providing as wide a curriculum offer as possible in order to meet the needs.
So I know that the Chief Executive is going to come in there. So if I can ask then on that one, with the business together partnership, etc., and what's happening in the Cardiff Capital Region, can you take our concerns to the college and to that organisation to try and get these courses in place?
Thank you, Madam Mayor. So just to come back on that question, so obviously Merthyr's got Education Partnership panel, and the college are active participants in that. The discussion is live at the moment, and in terms of how we engage from a regional inward investment in terms of pipeline of businesses to make sure that we've got the pipeline of ready staff coming through from all levels of education to make sure we can we get the pipelines lined up for our learners to go into active employment across the region. So we've got an upcoming scheduled event called the Hydra event for the Education Partnership Panel and wider, including all our schools. And I've engaged with Cardiff Capital Region to be part of that exercise. And that conversation is live now to make sure that we do have the dialogue between CCR in terms of inward investment to make sure HEF here are understanding the requirements for the courses and development that's needed across, from a Merthyr perspective, but equally across the region as well.
And a final question, really, and perhaps you're the right one to answer this, and it's on the back of what we talked about earlier with the presentation from the Coalfields Trust, is it's so difficult, the transport links throughout South Wales at the moment. I know there's improvements coming with the metro, but can we lobby, I think all of us as a local authority, Transport for Wales, Welsh Government, to make travel for people, young children, to get to colleges, to get to schools, and for people who need care and need help, a lot cheaper than what it is at this moment?
Obviously, in terms of engagement from a council perspective, that's probably something that the leader and the cabinet want to take up. But obviously, Welsh Government come out with their priorities in terms of, and transport being one of those. The conversation we've had in terms of transport for the Northern Valleys, in terms of both through employment and, as you suggested, in terms of access to essential services, that is well understood. And those conversations, as you know, via CCR and Transport for Wales are happening in terms of how the investment is shunted into for the correct projects for development, but I'm sure it's certainly something that the leader and cabinet may want to raise with colleagues.
Thank you.
No further questions? Any comments then, please? Councillor Lisa Mitten.
Chair. Thank you, Chair. So I just want to echo the points that are on page 72, 73, and just say these out loud, I guess, with a little bit of a conclusion from myself. So if you look at the benefits, and you just pop down to bullet point 4, which says fair and equitable policy with respect to faith-based education, and understandingly, it's now fair and equitable with regards to that, with regards to Welsh medium education. But it's not fair and equitable to those where we can't provide that provision with our own authority. And so we are disadvantaging young people within this borough by taking away this transport, albeit without further consulting the college about what their aspirations are for 26-27 curriculum year. It also says just underneath that, it keeps more Merthyr Tydfil residents studying within the county borough because we are paying for students to study outside the county borough. Well, no, it won't, will it? Because we can't help them study in the borough because we're not providing the courses that they need, as alluded to by myself and as alluded to by my colleague, Councillor Geraint Thomas, with regards to how the economy is changing and the courses that are now available. Consequences of this option, well, the biggest puzzling one year for me is the second bullet point. So it actually says, there is also likely to be an additional cost incurred providing transport for to the College Merthyr Tydfil instead of Coleg y Cymoedd, Pencoed or St John's. These costs would need to be deducted from the initial 45k that would be saved. So we're not actually really going to be saving 45k then, are we? That's a fictional amount, isn't it? It's not a set in stone amount. So we're agreeing a recommendation here to save 45k was not true, because that bullet point's telling us it's not true, because that bullet point's telling us in black and white it's a consequence, that actually won't be the true saving. It'll be a lot less. So disadvantaging learners for a figure that we don't actually know. And then, as I said, when you go down, and this is the big one for me, potential small negative impact on people not in education, employment or training needs. These are our most vulnerable students, doesn't matter whether it's 1, 10 or 100. These are our most vulnerable young people and we should be doing everything in our power to protect them. If this is not a 45k saving, it could result, because I'm just plucking a figure out the air because we don't know it, a 22k saving, etc. That could protect our young people most vulnerable. Therefore, I cannot support this because it's not properly reported, the figures aren't true, and also because in December 2021, by the majority of people within this chamber, I as leader then was pressed, spotlighted, begged to take and listen to public consultation overwhelmingly when we talked about the Greenie. And I was told, as leader of this council, you must listen to the public in Merthyr Tydfil. So I'm going to tonight yet again, and I'm going to vote against this because the public overwhelmingly voted for it to remain the same. Thank you, Chair.
Thank you,
Am
Councillor
I able to
Mitten.
respond in terms of the costs? No, I can't. Can I?
So if you have an absolute answer, you can give it as personal clarification, yeah.
So in terms of the costs, the figures within the report are based on the position as at the academic year 23-24. The actual figures that will be saved in any given year will vary depending on what the actual costs are for the transport that's been provided in that year. So the current figures would be more like £54,000 based on the current academic year's costs. That isn't reflected in the report because the report was intended to be reported as of September the 18th, at which point we didn't have that information. That information has only just become available. In terms of the potential additional costs that would then need to be considered for putting the transport on to the college, you can't quantify that at the moment because you don't know what decisions those young people will take in terms of where they're going to travel and whether or not additional transport would have to be put on. It may be there'd be additional spaces on the buses that are already provided. It may be they would need to have a bus or train pass. So the figure of 45k may very well be a higher figure in terms of the actual saving that's achieved, rather than it being a significantly lower figure. But it's not possible to quantify that, and it wouldn't be at any time in any report.
You shouldn't have been asking questions because we had ended the questions. So you made a comment and he has clarified the comment. That's the end of that debate.
I did, but he hasn't clarified it correctly.
Well, I'm sure the officer would say that he has told you the most he can tell you.
Councillor Brent Carter.
No, if you call Brent Carter, that will end the debate. So I think you need to call Councillor Simmons.
Apologise. Councillor Michelle Simmons, please.
Thank you, Madam Mayor. Great to see that the report supports out-of-county Welsh Medium post-16 and faith statutory education. However, saying that, having read the report and the supplementary comments provided by residents and students, they cannot be ignored. We have an unreliable transport service. We have a large percentage of disadvantaged families. Even going with option 2, we are restricting our young people's opportunities, which I don't believe fits or aligns with our RAS strategy, which is the raising aspirations and raising standards. So I won't be supporting this tonight. Thank you.
Thank you, Michelle Simmons. Councillor Councillor Geraint-Thomas, please.
Thank you, Madam Mayor. As my colleagues has put quite eloquently tonight, you know, there are big issues for us with this report. We know when it comes to the budget setting process, school transport is going to be high on the agenda. We know that, right? It's growing so large year on year, and we know there's huge pressures with it. But unfortunately, that's what we've got. We've got to deal with it. You know, we want our young people, our children, to get the best possible start to life. That's what we say in this council, the best possible start to life. And the best possible start, the best possible education, and we're talking about raising aspirations, raising standards. Why would we not harm our children's aspirations at 16 so they can't do the courses that they want to do for a couple of £1,000? I'm sorry, I can't support that. You know, let's keep the children's dreams alive. You know, that's what Merthyr Tydfil should be about. Thank you.
Thank you, Councillor Thomas. Councillor Declan Salmon.
I don't know if I call you a madam or chair. I think I've woken up in the twilight zone, to be honest, because just listening to some of the comments that have been made, these are questions. We don't have to answer them. Obviously, we're out of that. How long have you been working on this report? It's not the 2 weeks that the new leadership had been in. To be honest, this has got to be something all cabinet and all the leadership would have known about for ages. So I just don't understand where you're coming from now. To be honest, it's have the leadership woken up now? Oh, sorry, the previous leadership just woken up now. They're out of leadership. It's absolutely ridiculous. But one thing I will say, it might be a good idea to defer this agenda item if Councillor Mitten is right in saying that the figures are wrong. I'll come back at another date. Thank you, Chair.
Thank you, Councillor Salmon.
So are you proposing that it's deferred? No, that's fine. Thank you.
Councillor Brancarter.
Thanks, Madam Mayor. Yep, I think Councillor Salmon has hit the nail on the head. Interestingly, you know, I'm not here to throw stones and have a bun fight tonight. You know, it's the first council meeting, and I want to start as you mean to go on and work closely with everybody across this chamber. However, it's interesting that this report should have been heard 2 weeks ago, but was pulled mysteriously, and I'm not quite sure why. If it was, the previous cabinet would have had to take this report and not myself. Also, just to address one more point that Councillor Mitten made, in terms of it's easy to throw away words like overwhelming, but when we're looking at the figures, you're looking at 52% as opposed to 39%. When I'm sure when I went to school, that's certainly not overwhelming. In terms of the council, had a very good response to the consultation, and I'd like to thank everyone who took the time to get involved. The well-considered and detailed comments have helped inform the way we've updated the policy. There's no legal obligation on the Education Department to provide free transport to post-16 students. However, from the consultation, it's clear that completely removing the discretionary provision of post-16 free transport would have a negative impact for many and create barriers to education. I'm therefore pleased that free college transport will continue for students attending Merthyr College who live 3 miles or more away from the college, and the free transport will continue for those who've chosen to study at Ysgol Gyffwn Rhydywyn and St John Baptist Church in Wales High School for those attending for school statutory education. I do want to address the concerns about accessing courses not available at the college. What I would like to say is we've got almost 2 years now to work in partnership with Merthyr College to ensure that many pathways and courses possible that currently sit outside the county borough are provided. Thanks, Madam Mayor.
Thank you. Can we put this to the vote then, please, Monitoring Officer?
Thank you, Deputy Mayor. Can I ask those online then? Councillor Gareth Richards, are you for, against or abstaining?
For.
Thank you. Councillor Darren Roberts, are you for, against or abstaining?
For.
Thank you. Councillor David Isaac, are you for, against or abstaining?
For.
Thank you. Councillor David Hughes, are you for, against or abstaining?
Abstain.
Thank you. Councillor Kevin Gibbs, are you for, against or abstaining?
For.
Thank you. So that is carried. Deputy Mayor.
Next item, item 8, to deal with any other urgent business or correspondence. I've received correspondence of Councillor Jamie Scrivens, which he'd like me to share with everyone in the chamber this evening. Councillor Scriven, alongside Darren Thomas, founder and CEO of Signposted Cymru, and Chris Morgan, are currently in Nepal on their Everest Base Camp and Island Peak Challenge for mental health. They are raising funds for Signposted Cymru, a mental health charity based in South Wales. Signposted Cymru provides immediate support to anyone struggling with their mental health, offering services like counselling, fitness programs, mindfulness and financial assistance across Wales. Due to the extreme weather conditions, the route to Everest Base Camp has been closed for 2 to 3 days. The snow and ice have made it too dangerous to continue. Darren and Jamie pushed on to the next town, hoping for a chance to complete the challenge. However, many groups have been forced to turn back, with no visible track and treacherous ice covering the ground. It just isn't safe. The whole team have done their best, but sometimes the mountain has the final say. Safety is always a top priority. Sadly, some lives have been lost on this trip, and our thoughts go out to the families affected. Jamie, Darren and Chris are expected home this week for a well-deserved rest. This journey was dedicated to the memory of Lucy Gardner and Alex Meek, whose legacies continue to inspire and motivate others to make a difference. Councillor Scriven has said that they raised over £1,000 so far, and the donation page is still open to those who wish to donate and help Signpost Cymru continue to offer the crucial services they deliver. Every contribution makes a difference, and thank you to everyone who has supported them so far. Councillor Jamie Scriven. On to item 9, to receive communication from His Worship the Mayor. I don't have any, so I declare the meeting closed. Thank you everyone for your attendance.